Let me move for the next keynote address with Venkateshwara Varma Srivastava, Principal Solutions Architect and Independent Researcher Scholar from USA. His keynote title is Private AI for Secure Innovation in Healthcare. I warmly welcome Venkatesh for his presentation.
Hey everyone, good morning, good afternoon, good evening to all the folks across the globe who joined this conference. Thank you to the organizers who has invited me for this keynote speech. Little bit about myself before I start. My name is Venkateshwara Varma Srivatsavaya. I currently live in Rhode Island, USA. Work for a company called Cloudera. I'm working as a principal solutions architect, and Cloudera is one of the data and AI companies which operates across the globe. So let me share my screen. Give me 1 second. Okay, please let me know if you can see my screen.
Yes, sir, it's visible.
Okay. So the topic which I wanted to discuss today is I would say one of the critical areas within the AI innovation space, right? So one of the most regulated industries. So healthcare, banking, insurance. So these are all some of the most regulated industries where the innovation kind of gets hindered by a lot of regulatory requirements, compliance requirements, etc. So as part of this, I want to discuss on specifically on healthcare, which is again, especially since my background is from the USA. So my speech will be around the regulations in the USA, but the same applies across the globe, because end of the day, healthcare and privacy is kind of critical for almost like every country. So what is the current healthcare AI paradox? So there's a lot of opportunity in healthcare, right? So healthcare organizations like hospitals or organizations across the globe, they have a lot of rich data sources, right? The EHRs, which is nothing but the electronic health records, like your medical records, patient records, medical imaging, your genomic sequences, basically all your the medical data coming out of the medical devices, the wearables, right? So all of this data, basically, they have the capability to enrich AI, right? In order to enable many use cases like disease, like predicting a disease onset, personalize treatment protocols, and prevent adverse outcomes. So there's a lot of opportunity, but at the same time, there's a lot of barriers also, right? There are stringent privacy laws. So patient data is really important, because it is PHI. PHI is nothing but your protected healthcare information. So that is the information which you can use to basically identify somebody, right? And that's not acceptable in many countries. So there are stringent privacy laws and compliance requirements, right? So a lot of auditing is needed. Without proper auditing, a lot of federal agencies do not give the required approvals, right? So in short, there are significant barriers because of your regulations and compliance requirements. Just sharing some evidence, right? So BMC Health Services conducted research in Sweden. So basically the same thing. They say the same thing, right? Regulatory and ethical frameworks consistently lag behind the AI innovation capabilities. And Ernst and Young conducted in 2024, they conducted a healthcare research within the US, and they say the same thing. The unclear regulatory guidance delays organizational investment decisions. And American Health Association, they've publicly written a letter to the White House, basically mentioning the same thing, that there are multiple federal agencies and there are overlapping regulations, right? Each federal agency has a different regulation, and it is often basically confusing and causing a lot of cost to the healthcare organizations in maintaining the compliance. And NPJ Digital Medicine has a good research paper that talks about the same thing. A lot of FDA approved AI devices, right? For example, the smartwatches that you're wearing, like an Apple Watch, right? Apple Watch, I believe, is the first FDA approved like AI device. So like that, there are like many devices which are approved by FDA, but the problem is their documentation is not transparent enough, right? The amount of diversity they've kind of used in terms of their, let's say, demographics and the patient pool that they've researched, that documentation is not clear. That's what the research says. And PLOS one is another one where they're also saying the same thing: legal barriers, data governance challenges dominate implementation obstacles. So if you look at this, there are like 5 main root causes, right? One is it's very like the regulations are very ambiguous, right? So different federal agencies, different jurisdictions, there's a lot of confusion and risk, and the compliance documentation is not clear. The model transparency, like what our models are being used for, let's say the AI innovation, they do not have enough like lineage tracking, right? They do not have enough explainability. And the infrastructure itself that kind of provides a backend support, like a backbone to this AI innovation in healthcare, it's all siloed, and there is no centralized like governance and consistent security, right? And the biggest problem is the fear of exposing this protected healthcare information PHI data. Once the data leaves the organization control boundaries, then basically it is at risk for exposure. So now we have talked about the challenges, like what is the solution, right? So private AI is kind of like an architecture that, kind of resolves some or even most of these problems, right? So at a very short, what is private AI? Private AI is your compute or your algorithms or your AI models. They travel to data. Your data doesn't leave its boundary. It doesn't go to the compute, right? Your compute comes to the data. So that is the very high level of what private AI is. So some of the core principles, right? Data locality. Your PHI data stays within your secure boundary and it doesn't leave. Your compute, algorithms, AI models, everything basically run within that boundary. Unified governance, meaning you have lineage tracking. Who is accessing the data, what they're doing with the data, how the data got transformed, during different phases of your AI, AI models, AI life cycle. So that is your unified governance. Hybrid flexibility. Basically, your data is in your local, right? But you are able to burst your compute into the cloud, right? So the compute is coming from the cloud, but the data is still within the secure boundary. And security by design, right? What that means is you're taking care of authentication, authorization, your data at rest encryption, data in transit encryption, and basically all of these concepts, security concepts, are by design. They're not like an afterthought. They're embedded in the design itself. And responsible AI, like continuous monitoring, auditing, basically sending reports to the compliance agencies, right? All of this is like built-in transparency, for the compliance needs. So how is the architecture of private AI? When we go into the technical detail, how is the architecture? Basically, you have a clinical data layer, right? The data layer is a governed lakehouse. Again, as I said, it has authentication, authorization, encryption, and basically a comprehensive security for data and metadata management. And then you have the AI workspaces. So for the AI and the data scientists and the AI and ML engineers, for them to work in like safe, secure private environment for the model training and inference without leaving the healthcare organization's secure boundary, right? And then you have model registry for model versioning and tracking, and then you have lineage of how that passes through that entire life cycle. You have monitoring dashboards, again, for the responsible AI monitoring with continuous audit capabilities and compliance reporting. You have hybrid extension, right? Again, that is nothing but bursting compute into cloud when you do not have enough resources in your on-premises data centers. So this entire basically architecture, the beauty of this design is it operates within your secure boundary, right? It doesn't leave your secure boundary. So what is the biggest advantage it brings for your protected healthcare information? It stays local. It doesn't leave it. This is, I would say, this is like the top requirement for all the federal agencies. And so how do you achieve it? Like, what are the different implementation models in how this can be achieved, right? So one model is on-premises data center, where entirely everything is in data center, both data and compute. That is your on-premises data center model. The second one is like a private cloud VPC model, where you are in cloud, but still it is a secure network that is like only where you have access, right? Like nobody else has access, only you have access. It is only isolated for that particular healthcare organization. That is called private cloud VPC model. Then you have hybrid model, where you are operating both on-premise as well as private cloud. But the thing is, data is only in on-premise, compute is both on-premise as well as hybrid cloud, and everything across the board, they have the same security governed by your healthcare organization. So how is this helping some of these regulatory mandates, right? So what you see here are some of the most I would say noted like regulatory bodies in the USA, right? Either HIPAA or high-tech FDA. So each of them requires something from the organizations. For example, HIPAA requires data residency for data to be local, and high-tech requires encryption. FDA requires model traceability. So each of these different compliance bodies requires different. They have different requirements from your AI infrastructure or your AI entire ecosystem that you have in your organization, right? And the private AI architecture that I was talking about kind of handles all of this, right, by design. So just to give an example of like what are the use cases, right? So in one of the main use cases like predictive patient care. So I can give a very simple example. For example, there is a healthcare organization called Mayo Clinic, right? So Mayo Clinic has something called AI ECG, right? So typically in the US for cardio health, the very first test is kind of like an ECG, and then basically whatever is detected in that ECG, basically then they go to something called echocardiogram, right, to kind of confirm their analysis, right? So what AI ECG does is AI ECG kind of predicts that this person has like X amount of high rate of like let's say heart problem, right? For example, left ventricular dysfunction, right? That is one of the heart problems, and so they get prioritized over others, and they get to the next step of the echocardiogram, because in the US the process of healthcare is kind of slow comparatively, and some of these like AI enablement kind of helps speed up the process, and that can actually really save lives, because every day matters when it comes to healthcare. So far I've spoken about what are the challenges. I've spoken about what is the solution, what is private AI. So I'm going to take Cloudera as a reference platform, right? So Cloudera basically has a product called Cloudera Artificial Intelligence, which is CAI. So Cloudera Artificial Intelligence kind of summarizes everything that I've spoken so far. It's a product which operates on premises. It operates on cloud. It has the security and governance, authentication, authorization, basically your lineage tracking, auditing capabilities. Pretty much what I've spoken so far about private AI, everything is part of this product, and it enables you to basically seamlessly do your AI development as well as AI inferencing in production. So how it does this, right? So if you go like take a look under the hood, so this is the technology stack, right? The clinical data layer that I was talking about is on the open data lakehouse, which is powered by Apache Iceberg for the table format, and Apache Ozone for the object storage, which can support up to like 10 billion objects, right? And then you have an SDX governance layer where you have Apache Ranger and Apache Atlas. Apache Ranger is for auditing and role-based access control, and Apache Atlas is for lineage. And then you have Cloudera AI workspaces, where it provides a secure collaborative environment for data scientists and ML engineers to both develop as well as run models in production. You have model registry, which is powered by ML Flow, which is the centralized model management with versioning, experiment tracking, and deployment orchestration. And then you have security and audit controls. You have encryption powered by Ranger KMS, and you have authentication powered by Kerberos, and you have continuous monitoring and compliance reporting integrated through the entire stack. So these together, all these components, basically they form like an integrated, open, interoperable platform, which is like highly proven in healthcare production environments. So one thing I want you to notice when I say open, so far everything that I've mentioned, these are all open source products, right? Apache Ranger, Apache Atlas, Apache Ozone, Apache Iceberg. So everything is open source. So what is the path forward? Innovation with confidence, right? So current reality is healthcare organizations or any other regulated organization, basically they have a dilemma, right? Either they choose innovation and kind of risk compliance, or they choose compliance and risk innovation and fall behind like their competitors, right? That is the current dilemma. And private AI solution is kind of like an architectural approach that removes this dilemma for these regulated like organizations like healthcare, right? And you can do both. You can do both innovation as well as your compliance. And tomorrow's opportunity is basically these healthcare institutions, they become AI leaders with the amount of rich data that they have available, and being compliant, they become AI leaders. They set new standards for responsible, secure, and ethical deployment of advanced technologies. And so I come to the conclusion of my speech. So some of the key takeaways that I want you to take away today is private AI means compliance is embedded in the design. It's not an afterthought. It is embedded in the design, and it enables you to innovate with confidence, right? Data sovereignty, basically your protected healthcare information remains within the healthcare organizations or hospital control boundaries, right? You have built-in governance, security, audit, and lineage capabilities integrated throughout the architecture. You have hybrid flexibility. You can operate on-prem, you can operate in cloud, in private virtual environments, and you can do both. You can do a hybrid model where everything is falling under the same security organization, right? And you have responsible AI, transparent, fair, and like accountable mechanisms which ensure stakeholder trust. So that is it. I hope this was informative, and I hope this sparks some like thoughts on how to take this forward. Right? If you have any questions, I'm happy to take it.
Any interactions upon the presentation, please? Okay, thank you, sir. Thank you for your presentation.
Thank you for this opportunity. Thank you.